Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Though in the beginning of a third wave, Jos residents in Plateau State shun pandemic protocols. And Jigawa State continues ban on Durbar Festival to hold COVID-19 infections in check. And as COVID-19 cases rise in the United States, President Biden dubs the situation a pandemic of the unvaccinated. Well, since the announcement of an index COVID-19 Delta variant in Nigeria, the country is witnessing a rise in its daily coronavirus cases. The Nigeria Center for Disease Control (NCDC) says 238 cases were recorded last night in 5 states, including the Federal Capital Territory. Meanwhile, according to a report by the World Bank, an estimated 4,000 Nigerian children lost one or both parents between March 2020 and July 2021 due to COVID-19-associated death. The bank stated this in its latest post, co-authored by Laura Rawlings, lead economist at the World Bank, and Susan Hillis, a senior technical advisor, CDC COVID-19 International Task Force. Well, according to the report, nearly 2 million children have been orphaned since the global pandemic started in 2020. It also estimated that in Nigeria, 4,100 children were orphaned for losing one or both parents or the death of custodial grandparents. This is according to the Imperial College London's COVID-19 Orphanhood Data Dashboard developed for the report.
The Nigeria Center for Disease Control (NCDC) is asking Nigerians not to tire in their fight against COVID-19 and to visit a sample collection site or call their state hotline for a test if experiencing a sudden loss of taste or smell, difficulty in breathing, or fever. The NCDC is reporting 238 new infections of COVID-19 from 5 states and the FCT in the last 24 hours. This is 32 cases over the 206 cases recorded in the previous 24-hour cycle. Lagos was assailed with 181 cases. Akwa Ibom came a distant second with 45 cases. Oyo had 8. Ogun recorded 2 cases, while Ekiti and the FCT recorded 1 case each. Rivers, Ondo, Osun, Sokoto, Kano, Kaduna, and Nasarawa states did not report any case. Nigeria now has a total of 170,122 confirmed cases. 8 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,741. 2 people have died from COVID-19 related causes in the last 24 hours, raising the fatality toll to 2,130. The number of people on admission around the country has jumped to 3,240, while over 2.4 million samples have been tested so far. In Africa, the cumulative case count has gone beyond 6.3 million, and more than 160,000 deaths have occurred on the continent. Globally, more than 192 million COVID cases have been confirmed, while deaths have surpassed 4 million.
And Nigeria's overall response to the coronavirus pandemic has been affected by the global shortage of vaccines, especially as wealthier countries procure large volumes of the available supplies. Despite this, how do we ensure that we avert a spike in cases across the country? Well, in Plateau State, there are concerns on the non-compliance of the directive to the COVID-19 safety measures to prevent a third wave, in spite of government's efforts towards surveillance and testing. Let's take a look.
At one of the recreation centers, fun seekers were seen violating the directives on the usage of the face mask, while the same is also the order of the day in the popular Ahmadu Bello way, as citizens hardly put on the mask. Officials at the Plateau State Primary Healthcare Board expressed concern on non-compliance of the directives, in spite of government's efforts towards surveillance and testing, as well as enlightenment programs to sensitize citizens on the dangers of the virus.
It is something of great concern to us now as we are experiencing the Delta variant in Nigeria. We encourage people, people were relaxing their guard on preventive measures because the cases were going down and people were getting relaxed. But now with the advent of this variant, I think the emphasis is for people to be more vigilant and take these precautions seriously. That's the non-pharmaceutical measures, maintaining distance, wearing masks, using sanitizer, and so on forth.
Some residents share their concerns on the dangers of not adhering to these directives, which can escalate the spread of the virus in the wake of a third wave.
I don't want to be a victim of that, so I would advise everyone to put on his face masks, if possible, sanitize his hands still before going to the market, because crowd is a lot here. We have enough crowd here, and then you don't know who has it or not.
With the placement of Plateau State as one of the states on red alert for the third wave, and the fact that it might take a while for a second batch of vaccines to get to the country, it will be advisable for residents to adhere to directives on non-pharmaceutical protocols, as well as maintenance of good hygiene.
And just like a few other states in northern Nigeria, Jigawa State continued the ban on the Durbar Festival. This is to prevent a rise or a spike in coronavirus infections. Our correspondent Sadiq Ilyasu brings us the details.
Durbar ground at the Dutse Emir's Palace in Jigawa State. Every year, this ground is usually full to the brim, with people riding horses as part of Salah celebrations. In order to comply with the federal government's directive of COVID-19 preventive measures, the state government has ordered the suspension of the Durbar, and this has created mixed reactions from the public.
I'm not happy, because of the children, and they're supposed to go and watch horses, things like that. But now they are not happy, so we are idle at home. We have to go around the town at least, but we are not happy.
It is unfortunate, but it is not bad because of the situation we are facing in the insecurity and COVID-19 issue. So they know better than us. So they did something that is very, very good.
As agreed to take some recommendations as given by the Presidential Steering Committee, we had meeting all the relevant stakeholders. We unanimously agree that there will not be Durbar for tomorrow Salah and for the rest of Salah activities. And then secondly, we agree that all those who are going to eat prayer, they should find their mask, and they should be pre and after they should wash their hands. So these are the agreement that we resolved during the meeting, which the circular has been drafted. It will be conveyed to all concerned in the state for implementation.
The Delta variant of SARS-CoV-2 has since been detected in some parts of the country, and cases are surging. This has informed the decision to suspend the Durbar procession in Jigawa State. Sadiq Ilyasu, Channels Television News.
And outside Nigeria, the United States has an oversupply of vaccines and a segment of Americans who refuse to get vaccinated because of what is believed to be misinformation on vaccinations. Our Washington correspondent Maria Bird has more.
The United States has more than doubled the number of COVID cases in less than 1 month.
Yesterday, CDC reported more than 33,000 new cases of COVID-19. Our 7-day average is about 26,300 cases per day, and this represents an increase of nearly 70% from the prior 7-day average. The 7-day average of hospital admissions is about 2,790 per day, an increase of about 36% from the previous 7-day period. And after weeks of declines, 7-day average daily deaths have increased by 26% to 211 per day. There is a clear message that is coming through. This is becoming a pandemic of the unvaccinated. We are seeing outbreaks of cases in parts of the country that have low vaccination coverage because unvaccinated people are at risk.
President Biden and his administration believe that social media companies may be part to blame.
On COVID misinformation, what's your message to platforms like Facebook?
They're killing people. I mean, look, the only pandemic we have is among the unvaccinated. and they're killing people.
Facebook responded yesterday after the press briefing. They say that they've removed 18 million pieces of COVID misinformation. They've connected more than 2 billion people to reliable information. So does the White House find that sufficient?
Clearly not, because we're talking about additional steps that should be taken. They're a private sector company. They're going to make decisions about additional steps they can take. It's clear there are more that can be taken.
While President Biden is urging private tech firms to adhere to moral standards, he retracts some of his harsh statements toward Facebook.
Facebook isn't killing people. These 12 people are out there giving misinformation. Anyone listening to it is getting hurt by it. It's killing people. It's bad information. My hope is that Facebook, instead of taking it personally that somehow I'm saying Facebook is killing people, that they would do something about the misinformation, the outrageous misinformation about the vaccine.
The U.S. is on the verge of reinstating many of the early COVID restrictions and states of emergency due to the spike in those being hospitalized because of COVID, 80% of which are due to the Delta variant. From Washington, Maria Bird, Channels Television News.
And our Washington correspondent Maria Bird is with us now. Hi, Maria. I mean, in your report, we heard it called a pandemic of the unvaccinated. What is the true picture of the situation in the U.S.?
Yes, hello. Thank you for having me. The true picture is that we are seeing a astronomical spike in cases with those who are unvaccinated. But I will say that we also must remember, even those that are vaccinated are contracting COVID-19, and what is to believe is due to the Delta variant. The challenge obviously there, or I guess the benefit for those who have been double vaccinated, which means fully vaccinated, is they are 9 times out of 10 not going to have to go to the hospital. And obviously that then means that their survival rate is much greater than those who are unvaccinated. So that is what we're seeing across the United States. And it's also impacting much younger populations of individuals. And that is believed to really be where the spike in the number of COVID cases are at this time.
What is the government calling the major sources of vaccine hesitancy or misinformation in the U.S.?
Well, we know that ever since we run into a new administration, and we have a new administration, those who were anti-Biden supporters, very strong QAnon and Trump supporters, those who have never really believed in the coronavirus as a whole, have been putting out information regarding how this is a hoax and how don't believe the vaccines. How could this vaccine be something that really we can trust? It was put together so quickly. And so that type of information, especially for those who are unexperienced, right? Young people don't have a level of experience or knowledge to know how this vaccine could potentially benefit them. And as we know, that's been the greatest target audience, are our young people. And that is the group of individuals that we are seeing the lowest numbers of vaccination. And as we also have noted, there are those in the Midwest region of the country. You're seeing in the West and Eastern region, you're seeing higher numbers of vaccine rates. But in that middle part of the country, we are struggling there as well.
Is there a crackdown on some of the social media platforms like Facebook? And what are the experts saying about this, especially moving forward, to ensure that all the response on COVID-19 in the U.S. isn't lost?
There has been some crackdown. We've obviously not seen any type of sanctions put forth against some of these social media networks, which I believe that could potentially, obviously at some point, if they don't see where we're seeing a decrease in the number of misinformation being spewed through these ways of communication. And so at this time, I think it's more of a government taking a hard stand and trying to convince these social media companies to focus in on the moral standards that they should uphold and to play a larger role in being able to support the United States and the government and getting more individuals vaccinated to try to really curb the spread of the virus. And so that we don't see in the coming months, September and October, an extreme level of a heightened number and a spike in hospitalizations, which ultimately, unfortunately, has led to many deaths.
All right, Maria, thanks very much and do stay safe.
Thank you for having me.
And Germany's health minister is warning of rising COVID caseload as the country also expects lower hospitalization rates due to high vaccination. We have that and more when we return. Please stay with us. And Germany has updated its guidance after the World Health Organization warned that Europe was risking a new wave in August due to the relaxation of restrictions, the spread of infectious COVID-19 variant, and also low vaccination coverage. Well, according to the global body, due to increased mixing, travel gatherings, and easing of social restrictions, the Delta variant would be dominant in the region by the end of summer. While Professor Tobias Kurt is a professor of public health and epidemiology and director of the Institute of Public Health at Charité Berlin. He joins us on the program for more. Thank you for joining us.
Good evening from Berlin.
All right, first, it was the pandemic 2020. Now it's the floods. How has that affected the COVID-19 response? Because it would seem that at the moment, a lot of people are coming together in tight spaces just to overcome the crisis together. It must be a huge task for government at this time.
Absolutely. It has been a disaster, and these natural catastrophes remind us that global warming or climate change is really already a major public health issue. So compared with the pandemic, luckily, I would say it was limited to some regions, and obviously people have to gather together to respond to the flooding, and it was not such a mass event such as the Kumbh Mela in India or maybe the European Championship in soccer or football. So I don't think it's a major risk factor for the pandemic to grow further in Germany. It's more important that people get help and relief who've been suffering from the flooding.
But we also hear that state governments are scrambling to set up mobile COVID-19 vaccination centers. Western Germany, for example, as the rescue efforts increase the threat of infection. But residents are saying they have bigger concerns than the pandemic now. What do you think? Is the coronavirus threat still very real in Germany?
Right now, we are on a very low level of incidents or new cases that occur. And that's a usual scenario that when the pandemic is not felt that aggressively, so to say, then people are not as willingly to really accept vaccinations. But we are a very lucky country to have vaccines available, and people are accepting vaccines. So about 50% have now been vaccinated with 2 shots and 60% with 1 shot. So that's already not so bad. What we have to do better. And so we are more flexible. We're providing flexible vaccine solutions where people can just go to a bus or to a local store maybe and get vaccines, similar things that happen to the US. So hopefully people accept that. Some have doubts, that's okay, but we're trying to convince and say, look, that's the best way of really not getting sick and fight the pandemic.
We also know the WHO sounded a sort of warning, and this was during the Euro 2020, the crowds, the surging numbers to come from COVID in the coming days, weeks. Do we know if Germany has witnessed any surge as a result of the games?
I don't think so. So not many Germans were allowed to actually travel to the UK, where we have the Delta variant, obviously. But people are traveling to other countries where they meet a lot of people from many countries. And so that may be part of the reason why the number of infections are increasing right now. But I also have to say PCR positive, if you are in a country where many people are vaccinated, doesn't mean the same thing as before. So we have to be a little bit more careful in evaluating these numbers. Nevertheless, we have to be really looking at these numbers. And yes, the Euro 2021 was not such a really unrisky event. So I think they should have been taking more care of the public.
So looking at the numbers, especially the epidemic curve, what role is the Delta variant, which appears to be a threat all around the world, what is it playing on that curve?
Well, it's also playing a role in Germany. Obviously, this is now the variant which is driving the increase in numbers of infections that we see. And in a couple of months, we will see the next variant that is just the normal way of a pandemic. So luckily, the vaccines so far are working against the Delta variant. So they prevent from severe illness. They also prevent from spreading. Not entirely, but they prevent from spreading the virus to other people. So it's important really to get vaccinated and also be respectful to the pandemic, wearing masks, keeping distance whenever possible.
I want us to talk about vaccine mixing, because we've seen it with, German Chancellor Angela Merkel and a few others. But, the study and the report coming from Europe says that, it actually is better in terms of boosting and the sort of levels it gives to keeping one safe from COVID-19.
So I think the numbers, if you compare them, they're like minor differences. Really, if you have 2 vaccine shots, whatever the vaccine was, you're really, really well off in terms of fighting the pandemic for yourself and to prevent others from getting the disease. The mixing from AstraZeneca in this case with the BioNTech-Pfizer vaccine seems to work pretty well, but I think others are also pretty much at the same level. So I don't think people should focus on which combination or which vaccine they got. So far, all of them are working. And if you have received any vaccine, that's really a great message.
Finally, what's your advice to countries and their governments, the best way to beating the pandemic that seems to be unabating?
Well, depending where you are, unfortunately, in the world, it's like if you have access to vaccine or not, and if you can distribute the vaccine or not, if the public is ready to accept the vaccine or not. So it all depends on that. So health communication, obviously, is very important, that the public's been told and advised to keep a distance, wearing masks, getting vaccinated. Also information about vaccines, about risk and benefits. Obviously, the benefits are outweighing massively the risk. So all of this is important in terms of informing the public in your country, in your setting. And it really depends on your specific setting, what you can do, what you can tell the people, and also how you can improve the situation for the public.
We'd like to appreciate your time. Thank you so much for joining us on the program. Professor Tobias Kurz, the Professor of Public Health, Epidemiology, Director of the Institute of Public Health at Charité, Berlin. Thank you.
Thank you for having me.
As all eyes turn to Olympics, from the end of this week, Tokyo has recorded its highest number of new COVID infections for 6 months. The country confirmed almost 2,000 cases. The host city of the Olympics remains under a state of emergency that will last throughout the Games, and city residents have been asked not to gather in the streets to watch the Olympic events, while restaurants have been banned from selling alcohol and have been ordered to close early. Here's a look at the global update.
Olympic organizers in Japan say about 950 people, including officials and journalists, will watch Friday's opening ceremony of the Olympics at the main stadium from which spectators have been banned. In addition to the group would be performers and athletes in the Games. When asked about the tally of 87 COVID infections among athletes, officials and journalists, the organizers say completely getting rid of the virus is extremely difficult, making it important to quickly identify and tackle any new case. An infectious disease expert in Brazil say an accelerated COVID-19 vaccination rollout is crucial in preventing the spread of the Delta variant and other possible coronavirus variants in the country. Brazil reported the first case of the Delta variant near the end of June, with the same variant reported in several states in ensuing days. The National Laboratory of Scientific Computing of the Ministry of Science and Technology started to analyze various samples, which were randomly collected from all over the country every 2 weeks since March of this year. The Italian government is announcing limited restrictions for people who have not been vaccinated, including barring them from being served in indoor restaurants or from entering nightclubs, gyms and sports stadia. It's also considering limiting access to trains and domestic flights. A so-called green pass showing proof of vaccination or a negative coronavirus test would be required. Finally, U.S. infectious disease expert Anthony Fauci says the Delta variant of the coronavirus is the cause of more than 80% of new U.S. COVID-19 cases. but the authorized vaccines remain more than 90% effective in preventing hospitalizations and deaths. The more contagious Delta variant was first found in India earlier this year. It has since become the dominant version of the virus in the United States and many other countries. It's been detected in more than 90 nations nationwide. The U.S. Center for Disease Control says deaths from COVID-19 in the United States have averaged 239 per day over the past week, nearly 48% higher than the previous week.
Stay safe and continue to take responsibility. Visit our website for more updates, also a better understanding of the pandemic to see what's happening around the globe. There are also other stories there. It's channelstv.com. Thank you for watching COVID-19 Update. I'm Millicent Nwoka. Stay healthy.